Our DNA is the main source of information for the next generation medicine. In the next decade, medicine will be regional, based on your ancestry, will become deeply personal. Researchers and data scientists inside pharma companies needs this biological information as the guide to discover new drugs and treatments. Less than 1% of humans have sequenced their DNA. What is the big challenge? Yes, you're right, our privacy. We already know what happened with Facebook and Google handling our data. We must avoid a Cambridge Analytica phenomena with our DNA. Companies that offer DNA saliva kits are closing big private collaboration deals with big pharma companies with a static consent. After signing away your rights, you cannot delete or modify your DNA data. It's theirs. In GenoBank.io, we designed an encrypted personal wallet that gives absolute control and ownership of DNA by using blockchain. Basically, you're represented by an address in our network, and DNA data will be preserved in a unique data container for each customer, like an individual data body to preserve privacy. You'll have the freedom to upload, process, edit, delete, share, sell, donate, eradicate, or even inherit your data for your future generations. We use smart contracts as the baseline for new electronic consents that can change over time as transactions. The idea is that you can connect your data to the genomic revolution with control, transparency, and traceability for generations. Welcome to the crypto DNA world. Welcome to GenoBank.io.
Good morning and good evening. Today, we're going to talk to Daniel and Sharon from GenoBank. Daniel is the CEO and the founder, and Sharon is the COO. This conversation is brought to you by Stacks Ventures. GenoBank is the first anonymous DNA test kit on the blockchain and genomics data management platform. GenoBank is at the intersection of biosecurity and privacy, permissioning and privacy compliance bio NFT platform for collecting and managing medical data and biosamples. Sharon, Daniel, how are you guys today?
Doing well, thank you. How are you?
Thank you very much for the opportunity. We are very excited and honored to be here.
I'm really excited to talk to you guys. You guys are also in the City Coins track, and I know you guys are working within the Miami Coins and City Coin track. So I'm super stoked to have you guys on today.
Thank you very much.
Thank
we
you.
appreciate it.
So I heard that you guys did attend Bitcoin Unleash. Can you tell us how the event went? Did you guys enjoy the talks? Did you enjoy the vibes?
One of the great things about Bitcoin Unleashed was actually meeting our fellow cohorts from all over the United States and meeting them in person, since we're doing it via digital. That was amazing. And also to hear Munib talk about Stacks and really the whole concept behind it, really using it as a platform to do good in the community. But all of the presenters were amazing. Even some of our cohorts actually presented too. So it's very exciting, very exciting. Yeah, the energy was fantastic.
Just to add a little bit about Sharon, because I totally agree with Sharon. So it was good to interact with the community. It was full of energy just right before the Bitcoin conference, because there is, as you may know, there is a kind of a topic behind if Stacks really adds value to the Bitcoin blockchain or not. And obviously we think it adds a lot of functionality, because the main topic, I believe, of the conference is that Bitcoin, I mean, there's no doubt that this is the best money humanity has ever invented or have, but it is lack of expression in some other areas. And for instance, we are in the medical or genomic space, and Bitcoin by itself, it doesn't reflect anything. But by adding this functionality of NFTs, now you are literally enabling all the other use cases that usually are on Ethereum, right? But we all know the limitations of Ethereum, so we are super excited about the potential of Stacks and being able to interact with the Bitcoin blockchain. So that was literally the topics of the conference. Thank you. I mean, I was involved in blockchain since 2014 in the Singularity University, but fast forwarding in 2017, my son was diagnosed with a rare disease. And then I, obviously as a parent, after taking care of him, I started digging into genomics and into most of it, the data governance, because it was super difficult to get access to our own family data. Actually, we just got access to the reports, not the raw data by itself. So we don't know what is what copies are out there. So the main idea of GenoBank is, as you kindly introduced, is to have a data governance, right? It's where you can enable people to establish ownership and control over their most sensitive data, which is our genomics and medical data. I mean, at least that's what we think. So by using web3 technology, by serializing the data sets as NFTs or tokenizing them as we call it, we think we are adding a layer that could protect the researchers, because researchers do want transparency. Researchers are not I mean, they dislike data brokers, because most of them, I mean, again, the researchers are wants data, right? They need data to accelerate discoveries or new drugs or whatsoever. But people is in mistrust, because many of these companies in the space, usually facing the consumer, have done deals, right, with the data. They treated the data from the patients as merchandise, and now like everybody is like very concerned. So that's the main problem. But also, I mean, if it's okay, Sharon, we'll talk a little bit about the secondary problem, that is the lack of diversity and participation from our communities, right?
And so how I joined on the GenoBank team was because I knew a very good friend of mine who was a VC that invested in the company. And when I spoke with Daniel, it totally fit my personal purpose as well as my work purpose. And one of them being that, you know, GenoBank is very interested in creating more diversity in the genomic data arena space. And so I don't know if you're familiar with Henrietta Lacks, but Henrietta Lacks was an African-American woman, and a long time ago, her cells were taken from her and have been used for medical breakthroughs for polio. They're still used to this day after 70 years without the consent of her family. And so, you know, GenoBank is of course doing the solution of providing individuals or donors ownership and control, and keeping that privacy for their genetic data results, allowing them to then give the consent, but also at the same time keeping researchers compliant with privacy laws. And so by creating trust in the communities, we are basically allowing them to have that ownership, and more trust will create more individuals who will be interested in participating in more clinical trials, which will, as a result, definitely increase the genetic pool of multi-ethnicity genetics for further breakthroughs for certain illnesses. Because as you know, only about 2% of the genetic pool is mostly white European males, and that's what most of the medical results are based off of. So
It's important what you said, and like I shared with both of you, I've been very hesitant to use any of the DNA products, because I'm especially like what I've seen with social media, we don't know how they're going to use that data. And once these centralized systems are hacked, then your data is out there. So right now, the conversations, we're talking about deep fakes, right? So what happens when these centralized data sources are hacked, and it's a DNA warehouse? Now they have your personal data, but now they have your bio data. And I've been in healthcare before, and I worked in cybersecurity, and that's the trifecta. Once they get your financial data, your personal data, and your health data, you can't just order a new DNA. Well, not yet, maybe in the future. You can't just order new DNA at this time. How is the genomic data stored on the blockchain, and how do you guys make sure that it's secure and private with the full control that someone would like to manage their own data?
Oh, excellent question. I believe that obviously that's where we spend most of the time designing the system, because yes, as you said in the first minutes, we do not store genetic data on the blockchain. We reference biosamples. So in essence, what we think we're doing is giving an identity, not to the person, but to the biosample. I mean, we pair a wallet and a secure data room to a physical biotube that has a unique serial number. That's the only prerequisite for us to interact with any laboratory or any biotube or biosample extraction kit, is that they should have a unique set of serial numbers. So that's the only prerequisite, because we take that 2D barcode, and then we create a bio NFT that represents that specific biosample and biotube. So then obviously we create the wallet, and this wallet is paired as well with a secure data room. The secure data room is the vehicle where the person that holds the private key to that wallet will be able to interact with that biodata and that biosample. So today we do not deal with the identity of the person. We could partner with other projects that are dealing with DIDs or decentralized IDs. But what I'm trying to tell is that is why our kids are anonymous, because literally we think that, for instance, it's very simple to explain this when you have tests like HIV, right? The HIV test is very iconic because it's one of the most, let's say, confidential tests that are out there. You just want to test yourself, not even your phone number, nothing, not email, nothing. You just need a unique ID to collect your result, right? In this case, well, whatever the result is. But, and that was solved just by having a phone number and the serial code, right? That's it. But when you have raw data, like for instance, your DNA, so this is different because now you have to deliver data. I mean, laboratories deliver the data. So you need a secure data room. And that's where Web3 and the data ownership kind of era comes in, right? So again, in essence, we have a saliva tube, right? Or a biosample tube where you can put a swab or saliva or blood or whatever. I mean, we are biosample agnostic, and we give identity to the physical container and create a whole Web3 infrastructure surrounding that. And then we give you the control. We give you the 12 words or the pass phrase, the seed phrase. And then you can consent, you can revoke consent, you can browse your data, you can receive results. I mean, it's a whole infrastructure there to add as much value as we can without compromising your identity or your real identity. So I don't know if this clarifies a little bit more what we do.
Plus using the Miami coins to incentivize community. Yeah.
Oh yeah, I mean, yeah. We can talk a little bit about why Miami coins or city coins. We also agree that the main idea of targeting literally cities, it's great. Cities usually have a more paternalistic sentiment or emotion toward their citizens, and city coins for us is a good area of opportunity to try to incentivize the citizens to participate more in, let's say, clinical trials or public health projects, right? There is one very interesting right now that is looking for stool samples to have a map of antibiotics, right? Because there's an abuse in antibiotics. So just literally by sending a sample of our poop, I mean, researchers can determine what is the heat map of the use of antibiotics, because obviously the abuse of antibiotics is creating superbugs or super bacteria, right? Because they are getting resistant. So this is the kind of thing that you may want to incentivize as population to say, hey, just send an anonymous sample. We just need to know how are we doing, right, in this specific. But there are thousands of use cases. COVID-19, looking for new variants, and so on and so forth. I mean, there's obviously we could have a conversation with public health experts in terms of biospecimens to see the potential of this by combining again a kit that is anonymous but is traceable, and also can I mean, you can still own the data, right? Or the personality of the biosample, if that makes sense. Actually, we are working with a colleague, Kelly, from our cohort. She's creating a wallet for families, right? Specifically, we think that's a great idea because we have a family kit for genomic exploration. So again, is the intersection of literally data governance, right? So, but in this case, Kelly is more into the space of financial, right, wealth. But there is also the health wealth, right? So this is the aspect where they converged on Web3 to create capsules of valuable assets. And by valuable assets, it could be obviously your crypto, but also your biological digital assets like your genome or your health records, right? So we are partnering with these projects that are literally looking to educate the whole family about how to take care of cybersecurity together, right? Like saying, hey, there's a multi-signature wallet that maybe I can give one signature to my dad and the other signature to maybe my mom or my in-laws or whatever, right? I mean, there are different schemas of trust, but I believe this is the opportunity again to recover the family as a trust institution, right? Because again, we think that crypto enables individuals and families to become their own bank or their own custodians, as long as we learn how to keep the private keys secure, and yeah, they should not be forgotten, right? Because now that being said, exactly, that being said, in our use case, fortunately, it's not crypto, right? It's your data. You can just pay for another kit and you'll recover your data, or you will regenerate your data, right? I mean, it's not that major thing. I mean, obviously you will have to invest or to repay the test. So for us, it's also not that not that hard. I mean, if the passphrase is lost, it's okay. But in the case of the crypto, I mean, obviously we already know that that is a tragedy, is very dramatic when people loses their private key. But well, I extend a little bit.
But this is the great thing about the Accelerator program, because you learn about the other cohorts, your other team, family, Stacks family, and ways in how you can collaborate with one another. So it's been great. Hearing one another's, pitches, giving advice, and keeping, each other up on our toes, and boosting each other's confidence. And yeah.
And that's Kelly from Blue Studios, correct?
Correct. Yes.
Yeah. Yeah. So yeah, we're excited for what she's building. I love that movie. If you haven't seen it, go see it. And true story, it was filmed at my college that I went to, Cal Poly Pomona. So shout out to the Broncos. So what I was going to say is, with the DNA, the raw data, is that stored somewhere, and is there a cryptographic hash taken of, and that is stored on the blockchain? Does that data only, or is it stored on a decentralized storage network somewhere?
That's a very good question. So we are agnostic in terms of where it's stored, as long as there is someone, a human, known and public, that has a public profile that signs, cryptographically signs as the custodian or the permittee of that data. Yes, there is a reference of data. We use mainly three. The one that we most like is because we have, let's say, like an index of your genotype. What I would like to say is, for instance, the data that 23andMe produces is around 700,000 SNPs, 700 letters, right? This is let's say a matrix of positions in your DNA that are statistically relevant for a specific use case, right? So this is the most common, most standardized data set. So we take 44 of those SNPs because this is a standard inside many laboratories to identify biosamples. This is really a quality assurance kind of practice or protocol, where you use 44 SNPs. This is when you receive a biosample in the laboratory, you only have a tiny portion of it, which is 44 letters, 44 SNPs. And you create what they call a fingerprint for the biosample and for the data, right? Then you do all the rest of the protocol from the biosample. And when you finish, you have to compare again with these 44 SNPs, right? Just to make sure that you didn't mix the samples with other identifier. And so it's for quality assurance. We saw that this was already in the industry, and we are literally using those 44 SNPs again to reference to the bio NFT. With this small but very significant amount of data, you can discriminate a human in I believe it's a quadrillion, because it's impressive how with these 44 exclusive variants, or these exclusive letters that we all have different, you can discriminate like literally billions and billions of people with these 44 letters. Just to give you an idea, you only need 15 to determine if somebody is the father of a child, right? It's a paternity test. So paternity test only need 15. So imagine what you can do with 44. And 23andMe has 700,000. So again, this is how sensitive this data, how it's almost impossible to anonymize this data. So we also hash the document, or we may not. Because that's literally the integrity of the whole of the whole data set, which is important. But the most important thing is that in the future, we see that people will be able to declare those 44 SNPs as theirs, right? Is my let's say my instance. I am an instance, a unique instance of humanity, right? And this tiny number, without again compromising my real name or my identity, this is just for identifying my biosamples, right? This is kind of tricky, but it's very important, because the idea of having a pseudo-anonymous wallet allows you to be able to claim digital assets, to prove ownership, right, by signing a message of the corresponding wallet without comprising or without compromising your real identity, right? That's what we do. I say, hey, I created this NFT. The way you prove it is because you can sign with the original wallet, right? This is exactly the same. If you claim 44 SNPs and you have the wallet that claim those 44 SNPs, then they are yours. And if there is a controversy, you will be able to just send another biosample or go to a laboratory again anonymously. I mean, somebody will just be at the witness of that you're delivering that biosample, and then you'll be able to prove that those biosamples are yours, because again, it's unique. It's a fingerprint, right? It's a biometric. So, I mean, in essence, this is an ongoing system. We're customizing to what the industry already uses to discriminate biosamples and keep the quality of the deliverables, because again, there is at least 5% of errors inside the laboratories, and this type of mechanisms helps them to avoid human error inside, because they mix the samples, they contaminate the samples, and again, one way of knowing if the sample is high quality is to fingerprint it with the information of the patient. The first obviously was Miami coins, right? City coins. That was the entrance. But obviously NFTs on Bitcoin, right? I mean, we already know that. But the most I believe very, I mean, I am still very grateful, because the three leaders that we met in Stacks are incredible. I am referring to Victoria, to Trevor, to Kyle, and to Andrea as well, right? I mean, the whole team is super smart. They have a lot of experience, and they will give you super good feedback, sometimes tough love, because sometimes it's feedback that you're not totally prepared to receive, but they want one thing, which is for you to succeed, right? This is very important. They want you to be successful deploying your business, getting in front of investors and converting those pitches into successful raises. This is very important. I believe that the program is super complete, and specifically because they do care, right? So regardless, I mean, it's okay if you're not prepared. It's okay if you're not ready. They will just take you and try to help you as much as they can. And this is really, I believe, the magic of the program. And I'm really grateful about finding them or having met them so far.
And I totally agree with Daniel. Just the support has been phenomenal, from all the leaders all the way down to the foundation and so on and so forth. Just really wanting to see you to excel and help you with just growing.